Hi, Assalamualaikum. I would like to present statistics of HIV disease in Asia from 2000 until 2024 from Group 4 Fantastic 3. Here our group member, which is me, Siti Nur Atira, then Safirah Nusmina, and Muhammad Zulharis Irfan. Firstly, introduction. HIV remains a major health challenge, especially in densely populated and developing regions like Asia. The virus targets white blood cells and can lead to AIDS if left untreated. The study analyzed HIV data in Asia from 2000 to 2024 using a structure as a dataset. Key focus area include annual incidence rates, treatment effectiveness, mortality by age group, population demographic, and country-specific healthcare indicator. Focus is placed on Japan, India, China, and Indonesia, highlighting each nation's unique challenge and strength. The aim is to bridge the gap between raw data and real-world policy by identifying pattern and effectiveness intervention. Ultimately, the goal is to support data-driven public health strategies that reflect actual conditions on the ground. Next, we move with problem statement. There is a lack region-wide and data-driven studies that compare these critical indicators across countries using the real statistic. The available data from 2000 to 2024 shows clear variation in HIV incidence, recovery, mortality, and treatment costs across ASEAN countries. Many affected populations still face barriers such as stigma, expensive treatment, and lack of early diagnosis. This study addressed the gap by analyzing actual data from 6 Asian countries with the aim of producing a more accurate, visual, and comparative understanding of the HIV situation from between 2000 and 2024. The primary aim of this project is to evaluate the progression and response to HIV disease in Asia over 20 years period using real-world data. The project also aims to compare treatment outcomes, study mortality distribution by age group, evaluate the cost implication across countries, and provide a regional map of HIV prevalence. Another important aim is to demonstrate the importance of consistent and accessibility treatment, particularly in developing countries, to assess how vaccine available influence recovery outcome. Then the objective is to analyze the year-on-year trend of HIV incidence in Asia, to evaluate the effectiveness of various treatment types, to examine the gender distribution and population segment most affected, and lastly is to study the demographic impact of HIV in Asia. Next, literature review. HIV continues to be a major public health issue in Asia according to UNAIDS 2023. It's a immune system that leads to AIDS if untreated. It was a challenge in Asia, access to healthcare, stigma, and treatment costs. And according to UNAIDS 2020, antiretroviral therapy ART improves survival and recovery. Study focus on Japan, India, China, Indonesia, Saudi Arabia, and South Korea. The trend analysis is incidence, mortality, treatment outcome, demographic. Data insight help bridge gap between research and public health policy.
Methodology. For this project, we follow a structured methodology to ensure that analysis of HIV statistics across Asia is relevant and meaningful. The methodology section consists of 6 main parts: data collection, data description, data dictionary, analysis steps, derived attribute, and data issue. First, data collection. We begin by collecting the dataset from Kaggle, a popular data science platform. The dataset focus on HIV-related statistics from 6 ASEAN countries: China, India, Indonesia, Japan, Saudi Arabia, and South Korea, covering the years from 2015 until 2024. Downloading the data. Data was imported into Power BI. Number of record dataset 15 columns and 6056 rows. Next, data description. The dataset name is Global Health Statistics, and number of attributes is 15 attributes. This is a list and description of HIV dataset. First, we have country, year, gender, age group, population affected, incidence rates, mortality rates, recovery rate, treatment type, healthcare access, hospital beds per 1,000, doctors per 1,000, patient index, average treatment cost, and availability of treatment. Next, data dictionary. We create a data dictionary to classify each variable. Independent variable like country and year describe the context, while the dependent variables such as population affected or recovery rate represent the outcomes. We identify the data types like numeric, percentage, and alphabetic, and their level of measurement, whether nominal, ordinal, or continuous. Stage and steps involved. Our methodology follow 4 stages. First, data preparation. For data preparation, we clean missing or incomplete or inconsistent record or data. Second, data classification, where we identify variable rows and measurement levels. Third, data analysis. We explore relationship. For example, recovery by treatment type or gender or country. And lastly, data visualization, where we create an interactive chart in Power BI. Next, derived attribute. To gain a deeper insight, we also create a new attribute from original data. For example, we categorize recovery rates by age group. Also, we categorize incident rates by country. We also calculate affordability index by comparing treatment costs and income. Next, we also categorize healthcare access level, urbanization rate, and treatment availability. And lastly, data issue. First, there were missing value, especially for treatment availability in certain year. We exclude this incomplete record. Second, inconsistent reporting year means some countries didn't have data for all years, so we focus on years with complete record for fair comparison. And third, currency difference. Treatment costs were in local countries. We standardize all costs into USD to maintain consistency in analysis.
On the screen, we have the dashboard that presents statistics on HIV disease in Asia from 2000 to 2024, covering various aspects such as demographics, healthcare access, treatment costs, and disease outcomes. Here, a brief explanation of each charts. First, we have slicers that have for country, so that users can choose any country that they want to choose to select. Gender, which is a female, male, and other. Treatment type, they can select all, which is for medication and therapy. And then for age group, we have 4 group here. First, 0 to 18, 19 to 35, 36 to 60, and then 61 plus. And the below one is a year, so that here users can choose any selection a year that they want, which is either 2000, 2002, 2003, or any specific range of year that they want. Next, for the population effect of age group, that consists for population effect for age group that within the 4th group. Then we have population affected by gender, recovery rate, percent by age group, and country and population affected. So here, by using the slices, we can select anything that we want for specific information. For example, we have China, and if we want to select for age group for 19 to 35, and just only for the female, which with the range 2000 to 2034. Here we have for the recovery rate, for the age group 19 to 35, they have recovery rate for 6k cases, and for the population age group, they have 33 millions cases, and population affected for female that have age 19 to 35 is 33 million. And here in the chart for country, they show for the China region in the map. Next, for the next dashboard, we have 6 charts. First, urbanization rate and by country, that show urbanization percentage by country, incidence rates, recovery rate, and mortality rate by country. mortality rate by disease category, treatment costs, and average of per capita income by country, availability of vaccine treatment by country, healthcare access, doctor per 1,000, hospital bed per 1,000, and education index by country. And here, from both dashboards, we have 10 charts. The figure shows how HIV cases are spread across different age groups in Asia. The highest number of cases is among young adults aged 19 to 35 with 644 millions. This may be due to higher sexual activity and lack of awareness in this age group. The 36 to 60 age group follows closely with 630 million cases, suggesting that HIV is still a risk in later adulthood, possibly from late diagnosis or long-term relationship. Children and teens, which is 0 to 18 years, account for 575 million cases, which may be caused by mother-to-child transmission or early sexual activity. Surprisingly, people aged 61 and above also have 644 million cases, nearly the same as young adults. This shows that HIV remains a concern for older adults, possibly due to new infection or longer lifespans for those living with HIV. HIV cases in Asia are nearly equally distributed among different genders, challenging past belief that the disease mostly affects men. Data shows 827 million cases in females, 833 million in males, and another 833 million in individuals identified as other genders. This suggests that HIV affects people of all genders almost equally today, mainly due to change in how the virus spreads, especially through heterosexual contact. The large number of cases in the other gender group is especially important. It shows growing recognition of gender diverse communities in HIV data and highlight the needs for better support and care for these groups who often face more stigma and barriers to healthcare. This balanced distribution shows that HIV is now a pan-gender issue, not limited to one group. It calls for inclusive health strategies and better training for healthcare workers to ensure everyone, regardless of gender identity, get equal care and prevention support. The figure shows clear age-related difference in HIV recovery rates in Asia. Young adults aged 19 to 35 have the highest recovery rate with 96,000 cases. This may be due to stronger immune system and better access to treatments. All adults aged 36 to 60 follow closely with 95,000 recoveries, showing that the treatment still works well in middle age. However, the recovery rates are lower in other age groups. Children and teens 0 to 18 years have 93,000 recoveries, likely because of late diagnosis, dependency on caregivers, or lack of child-friendly medication. The lowest recovery rate is seen in older adults, which is more than 61 years, with only 85,000 cases. That means a drop of 12% compared to young adults. This could be due to weaker immune systems, other health issues, or drug interaction. Overall, recovery rates form an inverted U-shape, rising in early adulthood and drop with age. Map in the figure shows population effect in each country in Asia, which are China, India, Indonesia, Japan, South Korea, and Saudi Arabia. The figures likely reflect both actual disease burden and difference in testing and reporting system. Each color in each country shows the different level of population effectiveness. It may demonstrate the effectiveness of their healthcare systems and prevention programs despite similar population densities. The chart in the figure shows a clear link between HIV cases and urbanization in 6 Asian countries. Japan, with a highest urbanization rate, which is 94.9%, also has the most reported HIV cases, which is 46,53,000. China follows closely with 45.7k cases and similar urbanization. This suggests that cities with their dense population and complex social networks may create an environment where HIV spreads more easily. Interestingly, South Korea with 44,000 cases, Saudi Arabia with 44.707 cases, India with 44.33 thousand, and Indonesia with 44.37 thousand cases also all have almost similar urbanization levels and case numbers. Despite a difference in culture and healthcare system, urbanization may play a bigger role in HIV transmission than expected. The reference to 100% likely point to a standardized measure of or full urban reporting in some countries. Still, the same small in cases. This finding shows that cities across Asia share similar HIV challenges. This highlights the need for urbanization-focused HIV prevention strategies, especially in growing cities. Public health efforts should consider urban factors like sexual networks, migration, and access to services to better manage the spread of HIV. From 2000 to 2024, clear trends in HIV cases are seen across 6 major Asian countries, with China having the highest number. This could mean China has the most HIV cases, or it may reflect better reporting and monitoring system compared to its neighbors. Japan and India also rank high, showing that both rich and developing countries continue to face serious HIV challenges. South Korea, Indonesia, and Saudi Arabia are also on the list, proving that HIV remains a concern in a wide range of countries, from highly urbanized to those with limited healthcare access. However, the lack of recovery and death rate data raises concerns about whether treatment outcomes are being tracked consistently across countries. These 6 countries appear regularly in HIV reports, suggesting they are the main hotspot in Asia. Their ranking likely reflect a mix of actual HIV prevalence, population size, and how well each country reports data. Future research should explore whether these rankings are due to higher risk factors, a better detection system, or larger population. In conclusion, the majority of Asia's HIV cases are found in its largest economy, especially China. This means policymakers need to focus more on HIV in these countries as the virus continues to affect both developed and developing nations. Effective strategies should be tailored to each country's specific challenge and healthcare systems. From 2000 to 2024, HIV-related death in Asia vary across different illness types. Neurological problems cause the most death, 3.77k, showing how seriously HIV can affect the nervous system. Bacterial infection were close behind, 3.76 thousand, highlight how people with HIV are vulnerable to other infections due to weakened immunity. Chronic disease also cause many deaths, reflecting the long-term health impact of HIV. Respiratory issue, which is with 3.6 thousand cases, and parasitic infection with 3.5k cases were also major causes, likely due to common opportunistic infection in people with HIV. Viral co-infections such as hepatitis has the lowest death rate. This may be due to better treatment and lower severity compared to other complications.
This project faced a few challenges. First, some of the data was incomplete, especially for certain years or countries. The cost data was originally in different currencies, so we had to convert everything to USD, which may have caused slightly variation. Since the study only focused on 6 countries, the finding cannot fully represent all of the Asia. Lastly, we did not have information about social behavior or education level, which also affect how HIV spreads and is managed. In the future, we recommend including more countries to get fuller view of the situation across Asia. It will also help to add data on lifestyle, awareness level, and education to understand the root cause behind the number. Government and healthcare leaders should focus on improving access to affordable treatment, and especially in rural areas. They should also run campaigns to increase public knowledge and reduce stigma. Lastly, countries could benefit from real-time data system and better reporting so that the decision can be based on up-to-date information. From the data analysis, it is clear that HIV continues to impact Asian countries in very different ways. Countries with strong healthcare systems like Japan and South Korea show better recovery rates and lower mortality. In contrast, countries such as India and Indonesia still face higher infection rates and lower recovery. We suggest that healthcare access and awareness are still major challenge. Gender-wise, the data show that males and females are almost equally affected, with a notable number of cases among people in others category. This calls for more inclusive healthcare strategies that address the needs of individuals regardless of gender identity. Meanwhile, the cost of treatment varied widely. Some countries spend more on treatment but do not necessarily have better results, which suggests that money alone doesn't solve the problem if healthcare access is poor. Lastly, countries with a better access to doctors, hospitals and education tend to have better outcomes. This highlights how investment in public health infrastructure can directly impact the control and management of HIV. This project has taken a deep look at how HIV affected different parts of Asia by analyzing data from 2000 to 2024. Using a detailed dataset and individual tool, we are able to highlight challenges in infection, recovery, healthcare quality, and treatment costs. Some countries are managing the disease well thanks to the strong healthcare system and accessibility treatment, while others are still facing big challenges. This study shows that treating HIV is not just about managing, it's about building a healthcare system, reducing social stigma, and making sure it is available to everyone who needs it. By presenting this information in clear and visual way, we hope this report can support better decision and strong policy in fight against HIV across Asia. That's all from us. Thank you.